More senators want special session to pass funding for COVID-19 response. More senators want President Rodrigo Duterte to call for a special session of Congress to approve additional funding for the government's response to COVID-19. Senate President Vicente Tito Soto III said Thursday most senators agree with his suggestion for Congress to hold a special session to approve a budget for assistance to the poor while Luzon is on lockdown. Soto said he has spoken with Finance Secretary Carlos Dominguez III and an unnamed high-level economist about this. Added that he wants Congress to pass a daily food allowance for poor families in Luzon, like a 300 daily allotment per indigent family in Metro Manila, which he said will amount to 27 billion. Senator Christopher Bongo, Duterte's longtime aide, said he will recommend the holding of a special session if the government's stimulus package and additional funding from the Philippine Amusement and Gaming Corporation, Philippine Charity Sweepstakes Office and contingency funds are insufficient. For now, there are enough funds. But we shouldn't be complacent because the problem is evolving. Let's think of what happens in the coming days, what happens after the quarantine, and let us think of all possible scenarios. The Senate minority had earlier called for a special session to pass a supplemental budget for the government's response to COVID-19, including assistance to Filipino households, workers and businesses. Cagayan de Oro Representative Rufus Rodriguez also called for a special session for this purpose, which would be held virtually to avoid a mass gathering which could further spread of the disease. But Soto said Congress can still hold a special session in person, although with a skeletal workforce. We do not need a full staff in a special session. As long as there are recorders and a limited number of people to operate recorders, I suppose that will be enough. We will work on only one issue to be submitted by the palace, he said. Under the Constitution, the President may call for a special session of Congress at any time. The House Committee on Appropriations last week approved a 1.65 billion supplemental budget to address the issues brought by the infectious disease pandemic. This is lower than the Health Department's proposed amount of 2.35 billion to procure personal protective equipment for about 5,000 health workers. The budget, however, failed to reach the plenary before Congress adjourned for the lawmakers' 7-week Lenten break. COVID-19 has infected 202 people in the Philippines, with 17 of them dying because of the disease caused by a virus called SARS-CoV-2. 7 of those who had been infected have recovered. Globally, over 200,000 have been infected and 8,810 have died because of the viral disease. Over 84,000 have recovered. The disease is spread through small droplets from the nose or mouth when people infected with the virus cough or sneeze. To prevent infection, authorities are urging people to practice regular hand washing, cover their mouth and nose when coughing and sneezing, and avoid close contact with those who show respiratory symptoms. Commonly reported COVID-19 symptoms are fever, dry cough and shortness of breath. Those with severe and critical symptoms should call the health department.